Can we now turn to James for the last presentation? And James, yeah, it's hard to keep the ideas framed succinctly, but if you could, then we could have some plenary discussion at the end for those who have to leave at 5. So thank you very much, Gemma, and over to you, James.
Thank you. So one thing I should say in advance is I don't really work in education or philosophy of education. I'm a philosopher. Most of my work is on health. I work in health inequality. So this would probably be some thoughts from the outside, which hopefully might be fruitful, but it might also mean that I may say some things that seem a bit stupid to you and obviously wrong. But if so, hopefully that will also be productive. So for this talk, I wanted to explore some analogies and possibly differences between some of the philosophical literature and discussion on health inequalities as opposed to educational inequalities. So for this talk, I'm interested in a how to conceptualize an analogous relationship to that which is often discussed between socioeconomic status and health outcomes. That would be, and I think it should be a question which is at the heart of any joined up approach to educational policy. And it was really at the heart of Gemma's talk as well, which is what's the relationship between child poverty and educational achievement? And so that I guess I framed what I wanted to say in a slightly more, maybe a slightly less combative way than Gemma did. And so that in some ways I was thinking that, well, I guess imagine there's such a creature exists, but imagine that you were a sort of a decent Tory, and within the broad framework of their policy, you really were interested in what the relationship between child poverty and educational outcomes, and you wanted to do something about it that was decent, and you wanted to think about justice, probably within that sort of slightly tight framework that will probably annoy all of us. So I guess the kind of questions I wanted to explore with you today were basically, first question will be, if, and I guess we all agree that in fact this is the case, if poorer children achieve significantly worse educational outcomes, does this show that there's something unfair in the school system, or could the unfairness be somewhere else in our system? Could it be compatible with the data and with a correct view of justice to think that the formal educational system can be fully fair, despite the fact that there are significant differences in educational outcomes by household wealth? And if we do think that there are significant injustices that occur outside of the formal educational system due to poverty, and that these have a significant effect on educational outcomes, is it the job of the educational system to fully rectify these? Or can the educational system perhaps have done its job if it only reduces or at least doesn't widen these existing disadvantages? So quite a lot of the debate on health inequalities has quite a lot to say about it. So that I guess it's probably, although everybody here works on education rather than healthcare, you're probably mostly aware that, well, while there's often a lot of public debate about access to healthcare, particularly in the US, all the epidemiological literature will point to the fact that unequal access to healthcare just isn't the largest determinant of inequalities in patterns of morbidity and mortality. Other factors, often summed up as the social determinants of health, make a significantly larger difference. So it's just not a plausible plan for a health system considered as what people like GPs and hospitals do, to aim that there will be complete equality of life expectancy or outcomes between their patients who come from very different social classes or different backgrounds. It just wouldn't be feasible to do this. So that the philosopher Norman Daniels often likens healthcare to the ambulance at the bottom of the cliff. And if we know that certain groups of people are just much more likely than others to fall off the edge of the cliff, it seems like the problem is, as it were, the lack of barrier around the cliff, rather than thinking what we need to do is somehow to be able to maintain equality, despite the fact there's very great differences on who presents for healthcare and with what kinds of needs. And so I guess within the context of healthcare, and most people are happy with this in the context of the NHS, they say, well, what we're trying to provide is care on the basis of need. While there's a tacit acceptance that even if you do respond on the basis of equal need, that's unlikely to lead to equality of outcome. given that patients from poorer or socially excluded backgrounds are much more likely to get ill in the first place. And also when they do present, they're much more likely to have complex needs and greater comorbidities. So I'm kind of interested in your views on whether a similar kind of principle would apply to a good educational system or not, whether we might think, well, given that all these difficult effects of poverty, we might have done enough, or even if we've just stopped things from getting any worse than they were before, that you might think be a reasonable outcome. I suspect you're going to tell me it's not ambitious enough, so that maybe a couple of reasons why it wouldn't be ambitious enough. I mean, the first one would be to think about maybe a difference between healthcare and education, so that by and large, education and healthcare sort of are relevant to different portions of our life, so that although some people are ill as children, by and large, people tend to use healthcare much more fully in the later portions of their life. And so many of the effects of lifelong illness and chronic illness can be seen as the condensation of patterns of social disadvantage over a lifetime. And of course, school education occurs early in life, and the whole idea of education is to increase opportunities for the rest of the life. So I guess while perhaps it's plausible to think that at least to some extent, we can see healthcare needs as to a significant extent inevitable and socially determined, I guess it's much harder to get away from the idea that education can and should be aiming to overcome rather than just to accept the existing social disadvantages. And the second point of difference is one that maybe also was addressed by Gemma, but I think from a slightly different perspective. So I guess health outcomes aren't usually used for explicit competitive ranking of individuals, except in quite specific circumstances, for example, if you want to join the army or the police. But one of the main purposes to which examinations are put, it just is competitive, for example, thinking about who gets into university or what kind of university. And I think one implication of that is that even if education is provided according to educational need, and even if each person benefits equally from the schooling they receive, those who are further back to start off with and started with more complex needs will continue to be ranked more lowly than those people who started from a better position and with less complex needs. So if what we're trying to do in education is order people by means of attainment, and our education system doesn't really disrupt the initial rank ordering system, then this rank ordering system will just continue if everybody benefits equally from their education. So I think this creates quite an important difference from medical care, because in the case of medical care, the benefit to you from getting your medical care, it doesn't depend where you stand in a ranking of health relative to other people. It's just good to be in good health. So I think this provides a reason for thinking that to the extent that educational attainment is to be used explicitly for competitive ranking, the goals of education should be more ambitious than those of healthcare. We must, for reasons of fairness, make substantial attempts to undo the effects of poverty and make poverty irrelevant to the final ranking. Well, I think this is hopefully a quite plausible argument for the desirability of breaking the link between child poverty and educational disadvantage, either by getting rid of child poverty altogether or by blocking the connections between child poverty and worse educational outcomes. However, I think that to say that something is desirable is not yet to say that it's feasible or easy to obtain. I'll say a few more things, and I might pause and we can sort of open up for the whole discussion. So I want to say a bit more about sort of concepts and measures. I'm not fully sure whether what I say will be true of child poverty and educational attainment, but these are some of the thoughts that come out of thinking about the problem of measuring health inequalities and what I think would be likely to be the same sort of problems you'll face in thinking about educational inequalities. The first is the obvious point that what matters may not be measurable, and what is measurable may not be what matters. So I think there's a potential tension between what's required for measures of poverty and for educational attainment if causal claims are to be established rigorously, reproducibly, and in ways that could be transferred to other contexts. And on the other hand, what's required for definitions of poverty and educational attainment if they're to be normatively satisfied and to capture what really matters. So to put it in schematic terms, the easier and more objective we make both our measures of poverty and of educational attainment, then the easier it will be to debate and to refine causal relationships between poverty and educational attainment and the extent of these. But the more likely it will be that whatever it is that we're measuring fails really to capture the richness of what matters in a good education or what's really important about poverty. Second, I think we're going to suffer what I sometimes call the problem of the many inequalities. As soon as we start looking at the relationship between two broad and important concepts such as child poverty or education, we find that there's a myriad of inequalities, whether it's in the difference in test results, differences in verbal fluency, differences in obesity rates, and days absent from schools and levels of school completion, levels of going to university. As many things as you measure, you'll find that number of inequalities. So I think an important question is, well, do all the measures that we can possibly measure, do all the inequalities that we possibly measure matter, or are some of them more important than others? And within philosophy, a lot of philosophers maybe like things to be neat and tidy, so that a lot of philosophers in political philosophy tend to work from the assumption that, well, at most one, maybe one thing or possibly a very small number of things really matters for justice, and everything else really only matters insofar as it bears on that thing, that one thing that matters for its own sake for justice. I noticed that nearly all the discourse so far today has started from a very different assumption. That people want to say, well, we should be pluralists about measuring poverty, we should be pluralists, we should be capabilities theorists about thinking what education is for or what well-being is for. And I'm kind of very sympathetic to that from a normative perspective, but from the social scientific perspective, and particularly the perspective of somebody who's trying to persuade a skeptical but fair-minded Tory minister, you may make it a bit more difficult for yourself insofar as you define both poverty and educational outcomes in quite so complex ways, which then become quite difficult to measure and much more contestable. And one last point about, I think, about the very idea of poverty. So that one thing I found interesting is that sort of within our political discourse, politicians overwhelmingly favour a single-dimensional model of poverty. They just assume poverty is about lack of financial resources. Though nearly everybody so far has assumed that, well, it's much better to go for a multi-dimensional account of poverty, and that what seemed also interesting to me is that nearly all the multi-dimensional accounts of poverty that have been mentioned, as it were, say that as a lack of access to education is itself part of poverty. And I think that that's kind of plausible if we're thinking about measures of deprivation in terms of measures of well-being. But I think it greatly complicates the whole question about what the relationship is between poverty and educational attainment, because if you've effectively said that as it were lack of access to education or lack of education just is poverty, then you've as it were baked the relationship into the very way that you've defined the concepts. And I think to that extent you may find that it becomes more difficult to persuade skeptical people if they may well just say, well look, you've presupposed the very thing you've set out to prove. You've, as it were, defined lack of access to education in your preferred ways as poverty. So by definition, it follows that that to be poor, lacking education is to be poor, and to be poor is to lack this education this kind of way. And so all this is possibly a plea for maybe stepping back and thinking about, well, a variety of questions which I think are important. I don't have any answers to them, but I wanted to raise them because they're ones that I've been struggling about in health and inequality for years, and I think they're the similar questions that you need to work through. So I guess the big question would be, what should be the relationship between what goes on in formal education and levels of overall well-being or advantage enjoyed by children from different backgrounds? Well, we've discussed in detail today how the disadvantages suffered by children in poverty are multidimensional. And while these disadvantages obviously include educational disadvantages, they're not confined to educational disadvantages. And so we can think of health disadvantages, insecurity, and so on. In addition, education is only one sphere of society in which attempts are made to break the links between poverty and overall disadvantage. So I guess maybe what I should do in that case is end by restating in a slightly modified form some of the questions I started with. Should a good educational system aim to completely neutralize these multi-dimensional disadvantages, at least as far as they impact on educational attainment? Or is it more reasonable to acknowledge that a good educational system can have at best a limited impact on overall disadvantage, and to set a goal for the system which acknowledges this limitation? And perhaps the most important question would be then, well, given that our resources for education are always going to be limited, how do we distribute the limited resources that we do have in a way that's fair, given the fact that we can't do everything that we can for every child that would be optimal? And I don't know the answer to any of these questions, but those sorts of questions are the sort of ones that we've been struggling with in thinking about healthcare resource allocation for years. And so we have ways of measuring them. We have ways of thinking about how to play off different aspects like severity of illness versus capacity to benefit. I don't know to what extent people have attempted to do that in the context of education, but it seems that to try and to get clear about, well, given the variety of goals that are mooted in education and the importance of combating disadvantage, we need some kind of clarity about what the principles are that we should be following, and a greater debate about this. So that was the views of somebody who doesn't know anything about the philosophy of education about what you should be thinking about. So.
Thanks very much, James. And it's nice to have a provocation and a opportunity to define what it is that we are doing, what it is we think it's and why we think it's important to do it. So shall we just take a quick round of questions specifically to James, or comments specifically to James, and then I'll open it up